Tinea corporis, commonly known as ringworm, is a widespread fungal infection that affects the skin. This condition is characterized by its distinctive ring-shaped rash, which can appear on various parts of the body, including the arms, legs, and torso. The name ringworm can be misleading as it suggests a parasitic worm is responsible for the infection. However, this is not the case. Despite its name, it's not caused by a worm at all. The term ringworm comes from the appearance of the rash, which often forms a circular ring-like pattern. This can be alarming to those who are unfamiliar with the condition, but understanding the true cause can help alleviate some of the concerns. The real culprits are a group of fungi called dermatophytes. These fungi thrive in warm, moist environments and are adept at invading the outer layers of the skin. Dermatophytes are responsible for a variety of skin infections, not just Tinea corporis. They can also cause athletes' foot, jock itch, and scalp infections. These microscopic invaders love to feast on keratin, a protein found in our skin, hair, and nails. Keratin provides a rich source of nutrients for the fungi, allowing them to grow and multiply. This is why the infection can appear in different areas of the body, wherever keratin is present. Tinea corporis is highly contagious and can spread through direct contact with infected individuals or animals. Pets such as cats and dogs can also carry the fungi and transmit the infection to humans. It's important to be aware of this, especially if you have pets at home. It can also be transmitted indirectly through contact with contaminated objects or surfaces, such as towels, clothing, or sports equipment. Gyms, locker rooms, and other communal areas are common places where the fungi can be found. Practicing good hygiene and avoiding sharing personal items can help reduce the risk of infection. The infection manifests as itchy, red, ring-shaped patches on the skin. These patches can be quite uncomfortable and may cause significant itching. The appearance of the rash can vary, but it typically has a clear center with a raised, scaly border. These patches often have a raised, scaly border and may be accompanied by blisters or pustules. In some cases, the rash can become inflamed and painful, especially if it is scratched or irritated. It's important to avoid scratching the affected area to prevent further complications. Tinea corporis can affect people of all ages, but it is more common in children and individuals with weakened immune systems. Children are particularly susceptible due to their close contact with peers and their tendency to share personal items. Elderly individuals and those with compromised immune systems are also at higher risk. Factors that increase the risk of infection include living in warm, humid climates, sharing personal items, and participating in contact sports. Athletes, especially those involved in sports with a lot of physical contact, are at a higher risk of contracting the infection. The warm and sweaty environment created by sports gear can provide an ideal breeding ground for the fungi. Early diagnosis and treatment are crucial to prevent the spread of infection and alleviate symptoms. If you suspect you have Tinea corporis, it's important to seek medical advice promptly. Treatment typically involves antifungal medications, which can be applied topically or taken orally, depending on the severity of the infection. With proper care and attention, the infection can be effectively managed and cured. Tinea corporis, commonly known as ringworm, is a significant global health concern, affecting millions of people worldwide. This fungal infection does not discriminate, impacting individuals across all continents and from various walks of life. It is particularly prevalent in tropical and subtropical regions with high humidity and temperatures. These warm and moist environments create ideal conditions for the dermatophytes, the fungi responsible for ringworm, to thrive and spread. Children are more susceptible to ringworm infections, likely due to their close contact with others and less stringent hygiene practices. In schools and playgrounds, where children frequently interact and share items, the risk of transmission is significantly heightened. Several factors increase the risk of developing Tinea corporis. Understanding these risk factors is crucial for both prevention and treatment. One of the primary risk factors includes close contact with infected individuals or animals. Pets, especially those with visible skin infections, can be carriers of the fungi, making pet owners particularly vulnerable. This close contact is the most common mode of transmission. In crowded public places, the likelihood of coming into contact with an infected person or contaminated surface increases. Living in warm, humid environments further exacerbates the risk, as dermatophytes thrive in these conditions. The combination of heat and moisture provides an optimal breeding ground for the fungi. Sharing personal items such as towels, clothing, combs, and sports gear is another significant risk factor. These items can easily become contaminated with the fungi, facilitating its spread among individuals. Participating in contact sports where skin-to-skin contact is frequent also increases the risk of transmission. Sports like wrestling, football, and rugby are particularly high risk due to the close physical contact involved. A weakened immune system is another critical factor. Individuals with compromised immunity, such as those with chronic illnesses, undergoing chemotherapy, or the elderly, are more vulnerable to infections, including ringworm. Poor hygiene practices can also contribute to the spread of ringworm. Maintaining good personal hygiene, such as regular hand washing, showering, and keeping personal items clean, is crucial for preventing infection. Understanding the epidemiology and risk factors associated with Tinea corporis is essential for implementing effective prevention and control measures. By identifying and addressing these factors, healthcare professionals can develop targeted strategies to reduce the incidence of this common fungal infection. Public health campaigns and educational initiatives play a vital role in raising awareness about ringworm and its risk factors. By promoting good hygiene practices, encouraging early diagnosis and treatment, and fostering a better understanding of the infection, we can significantly reduce the incidence and impact of Tinea corporis on a global scale. Tinea corporis is a cunning adversary that exploits the body's largest organ, the skin, for its survival. The infection begins when dermatophytes, the microscopic fungi responsible for ringworm, come into contact with the skin's surface. These fungi are attracted to keratin, a tough protein that provides structure and protection to our skin, hair, and nails. Once they land on the skin, dermatophytes waste no time in launching their attack. They release enzymes that break down keratin, allowing them to penetrate the outermost layer of the skin, the stratum corneum. This invasion triggers the body's immune system to spring into action, sending white blood cells to the site of infection to fight off the invaders. The battle between the immune system and the dermatophytes leads to the characteristic inflammatory response we see in ringworm infections. The affected area becomes red, itchy, and inflamed as the body tries to contain the spread of the fungi. This inflammatory response is responsible for the discomfort and visible symptoms associated with Tinea corporis. Tinea corporis, commonly known as ringworm, typically presents with distinctive clinical features that make it easily recognizable. This fungal infection is not caused by a worm, despite its name, but by dermatophytes, a type of fungus that thrives on keratin, the protein found in skin, hair, and nails. The classic sign of Tinea corporis is a red, ring-shaped rash with a raised, scaly border. This rash is often itchy and uncomfortable, prompting individuals to seek medical attention. These rings often expand outwards, resembling the ripples created by a pebble dropped in water, hence the name ringworm. The expansion of the rash can be quite rapid, spreading to other areas of the body if not treated promptly. The center of the ring may be clear or have a pink or brown discoloration. This central clearing is a hallmark of the infection and helps differentiate it from other skin conditions. The rash can appear anywhere on the body, but is most commonly found on the arms, legs, trunk, and face. These areas are more prone to moisture and friction, creating an ideal environment for the fungus to thrive. It can range in size from a few millimeters to several centimeters in diameter. The size of the rash can vary depending on the severity of the infection and how long it has been present. Multiple rings may appear simultaneously, and they can sometimes merge to form larger, irregular patches. This can make the infection appear more severe and widespread, causing significant discomfort and concern for the affected individual. In addition to the characteristic ring-shaped rash, Tinea corporis may also present with other symptoms. These additional symptoms can vary from person to person, depending on the individual's immune response and the extent of the infection. Itching is one of the most common symptoms, and the affected area is often intensely itchy, leading to scratching and potential secondary bacterial infections. Scratching can break the skin, providing an entry point for bacteria and complicating the infection. A burning sensation is another symptom, with some individuals experiencing a burning or stinging sensation in the affected area. This can be particularly uncomfortable and may interfere with daily activities. Blisters or pustules may develop around the edges of the rash. These small, fluid-filled blisters or pus-filled bumps can be painful and may burst, leading to further skin irritation and potential infection, and dry, scaly skin is often observed within the ring. The skin within the ring may become dry, flaky, and scaly, adding to the discomfort and unsightly appearance of the rash. Recognizing these clinical features is crucial for early diagnosis and prompt treatment of tinea corporis. Early intervention can prevent the spread of the infection and reduce the risk of complications. If you suspect a ringworm infection, it's essential to consult a dermatologist for confirmation and appropriate management. A dermatologist can provide a definitive diagnosis and recommend effective treatment options to clear the infection and alleviate symptoms.